Okay, can you guys see the PowerPoint?
Yeah.
Okay. Delivering dental care. So, business assistants, clinical assistants, dental hygienists, and dentists must follow a specific routine. That routine starts with reviewing the patient record, having knowledge of upcoming procedures, and having the supplies and equipment ready. Now, most of that the assistant does for the dentist. The dentist, he just waits until you have it done, and then he'll come into the operatory. Now, if you look on the bottom, it's saying, what is four-handed dentistry? It's the process by which the operator and assistant work together to perform clinical procedures in an ergonomically structured environment. So, yesterday, for those of you that came into lab, we did a little bit of four-handed dentistry, and we will do some more practice when you guys come to lab. So basically, it's passing the instruments and receiving. And it's not only the instruments, but it could be the materials. Yesterday, we just did some instruments, and we'll get to do some more. Knowing your patients. So one of the best ways to know your patients and to be better prepared for the day is to have a brief meeting or review of the day before your patients arrive. So a lot of times they call them huddles, morning huddles. So you would all get there, say about 8:45, if the office opens at 9, and you will have a little meeting. And you'll discuss change in schedule or procedure, the change in the patient's health that could alter dental treatment, additional supplies or equipment that may be needed, preparation for the apprehensive patient, and assignment of expanded functions. So usually in the morning, they'll say, I want you to take x-rays today. I want you to be in operatory 1, you to be in operatory 2, you to be taking care of lab, or whatever the case may be. It could be assignments, or even the assistants can say, this is what I'm going to do, this is what you're going to do. So everybody has to communicate in the morning so they know how the day is going to go and you're not bumping into each other. Communication is the key, guys. So, reviewing the patient record. Several sections of a patient record are reviewed at each patient visit. The administrative staff, usually that's at the front, okay, checks for changes in personal information such as address or phone number change when they walk in. They'll say any change in your address, medical history, things like that. You guys are known as the clinical staff. You're going to check for health problems that may alter dental treatment, look for medical alerts, and you're going to review progress notes for the planned treatment for the day. So you will look at the chart. You will see what was done before, and usually in the chart, it'll say what is due next. Preparing the treatment area. So we have to make sure the treatment room is clean, disinfected, and ready for the next patient. Patient records, radiographs, and laboratory results in place. Sterile preset tray and other supplies in place. Dental chair positioned to seat the patient. And any additional equipment moved out of the way for the patient and the dental team. Greeting and seating the patient. So pleasantly greet the patient by name in the reception area, escort them to the treatment area, place the patient's personal items in a safe place out of the way of the procedure, initiate conversation with the patient because it's going to get very awkward if you don't. The silence will make you nervous and the silence will make the patient nervous. And then ask whether the patient has any questions about the treatment for the day that you might be able to answer. The other thing that you normally have to do, and I'm pretty sure we'll get to it somewhere on one of these slides, but I want to mention it just in case, is whatever the procedure of the day is, you have to get their consent and they have to sign a consent form. Now, team dentistry, components of work simplification, decreased number of instruments, ergonomically correct equipment. So basically, we just want to get the instruments that we need for that procedure. You don't want to get a whole bunch others. If you do need them, you leave them to the side. And if you need them, then you use them. Sequencing of instruments on the tray. So yesterday also when you guys came to the lab, I put some instruments in order that they go. Is very important, but always the basic comes first and then everything after that. And if you remember, the basic is the mouth mirror, explorer, and the cotton pliers. Then we have the correct positioning of the patient, dentist, and assistant to minimize fatigue, use of appropriate moisture control techniques. So we talked about that yesterday. It could be cotton rolls, HVE, saliva ejector, transfer of instruments and dental materials as necessary, and use of the least possible amount of motion, performance of expanded functions by the assistant. So you guys have a certain expanded function duties that you need to do, and those are the ones that you're learning in lab. Principle of team positioning. The dentist and dental assistant should develop positioning habits that allow access to and visualization of all areas of the oral cavity. Whenever the dentist and the assistant must stretch to reach for an instrument or gain access to an area of the mouth, stress is placed on the body. Accumulated strain contributes to lower back pain, circulatory problems, and muscle aches and pains. So if you notice, here's the dentist. He's sitting correctly in the chair with his back up against the operator stool. This unit here looks a little like ours because we have the side mount here. So this would be where the hand pieces are and the air water syringe. Then you, of course, you have the patient. Now we don't have a back to our operatory because ours is a teaching one, but in the office it might look something like this. And then there's a counter back here. Now, if you notice the assistant, I can tell you right now that the arm, where she has her arm, the abdominal bar is not correct. So this should come around and be in front of her, okay? Otherwise, you're going to get fatigued that way. Now, if she's just sitting there maybe for charting, that's okay. But if she's sitting there for a procedure, she's going to get tired. Positioning the patient. Once the patient has been escorted to the treatment area and seated, he or she is lowered to the supine position. You're going to ask to slide up the chair until the top of the head is even with the top of the headrest. Ask to turn his or her head to the right or left to allow easier access to a specific area of the mouth. The operator makes final adjustments to the chair to establish proper working distance, and the correct distance should be approximately 12 to 14 inches. Positioning the operator. So seated as far back as possible, as I showed you with the dentist, okay? Thighs parallel to the floor or knees slightly lower than the hips, feet flat on the floor, backrest of the chair positioned to support the lower portion or small of the back, operator's forearms bent at the elbow and parallel to the floor, and this is how it should look, okay? So get your back here for the support, and your feet should always be touching the ground on the operator's chair. Now, for the dental assistant chair, again, you're also going to be seated well back on the stool, feet on the base or foot ring of the stool, position as close as possible to the dental chair, legs parallel to the patient's chair, and your eye level should be 4 to 6 inches above the eye level of the operator. So again, see how the abdominal bar is in front of the dental assistant and her feet is on the ring, okay? Her back or his back is up against the chair. So you want to make sure you're fully seated on there, because I'm going to tell you right now, if you guys don't sit all the way back on this chair specifically, and you have all your weight over here in the front, the chair will tip over and fall on the patient, or you can fall on the floor. Motion economy. So there's 5 categories of classification of motions according to extent of movement. Class 1, that's when you're only moving your fingers. Class 2, fingers and wrists. Class 3, fingers, wrist, and elbow. Class 4, when you use the entire arm and shoulder. And Class 5, use of the entire upper torso. Okay. Again, if you guys are not sitting correctly and you're not utilizing the chairs the way it is, at the end of the day, you will have lower back pain. Now, there's different types of operating zones. Basic concept required for the efficient, comfortable practice of team dentistry. You have your operator, your transfer, your assistant, and your static zone. Now, this one here is for a right-handed operator. So the operator is usually the dentist, the assistant is over here, the transfer is right on the bib. As you can see, no transfer is going on in their face, okay? And then we do transfer sometimes behind the patient. That's the static zone. For a left-handed operator, so if the doctor is left-handed, it's the opposite. But again, we still don't transfer anything in front of the patient's face. Instrument transfer. An ergonomically sound way to practice dentistry using the skills of the dental assistant while including work simplification techniques. Dentist relies on the clinical assistant to have the supplies, instruments, dental materials ready for transfer into the dentist's hand. It requires coordination, communication, and practice between the dentist and the dental assistant. So again, yesterday we worked a little bit on it. It does take time to learn each other's movements. You're going to get to the point where you're so comfortable that you can transfer the instrument without even looking. Okay. Objectives of efficient instrument transfer. Understand sequence of procedures and anticipate when instrument transfer is required. Transfer dental instruments and dental materials with the left hand. Transfer instruments should be accomplished with a minimum of motion involving only the finger, wrist, and elbow. Instruments are transferred in their position of use. Instrument is transferred so the dentist can grab the instrument for its appropriate use. And an instrument being transferred must be positioned firmly in the dentist's hand. So usually the doc does not move his hand a lot. He'll keep it in one position. You come to his hand and you drop the instrument in his hand. He should not be chasing you for the instrument. And for the virtual students, when you come back to the lab, you will practice. In the meantime, for the residential students, you will already start having this practice. And you can do it at home actually by practicing on a pen, with a pen, okay? And have somebody pass you a pen, you receive, and then you pass it back. It looks easy, but sometimes it's not. I'll try to take a video when we're in the lab of how we are transferring instruments so that way you guys have an idea, especially for the virtual students. Grasping an instrument, there are three basic grasps. Pen grasp, the instrument is held in the same manner as a pen. Palm grasp, the instrument is held securely in the palm of the hand. Palm thumb grasp, the instrument is held in the palm of the hand and the thumb is used to stabilize and guide the instrument. So if you see letter A, that's your pen grasp. Letter B is your palm grasp. And letter C is your palm thumb grasp. We usually use letter C a lot for the HVE when we're going to suction water, saliva, blood, anything out of the patient's mouth. We usually hold it palm thumb grasp. Now, the transfer technique, dental assistant uses a specific single-handed technique for efficiency. It applies to hand instruments, dental handpieces, and even air water syringes. There are variations in instrument transfer, like your mirror and explorer, your cotton pliers, your handpiece, and your instrument with hinges. Now, a lot of doctors will take their own mouth mirror and explorer, but a lot of them are ready for you to pass it to them. Cotton pliers, because we use that to pass the cotton rolls in, you have to be real careful when you pass it because otherwise the cotton roll can fall. Handpiece, usually we don't do a lot of passing with the handpiece because the handpiece is right next to the doctor. And then instrument with hinges, when we go to the lab and we get to that, I'll show you how to pass instrument with hinges on there. Now, expanded function dental assistant, that's what you guys are trying to be, okay? Expanded function refers to specific intraoral procedures or part of a procedure performed by the clinical dental assistant that have been delegated by the dentist. So the advantages: increase productivity, less stress on the dentist, more patients seen, and increased job satisfaction. Dental supervision. So There's two types of supervision, direct and indirect. Direct, the dentist must be in the same treatment area as the EFTA for the assistant to perform the function. Indirect is when the dentist must be in the office area, but not necessarily be present in the same treatment room as the EFTA. So, a good example of that, of indirect, would be your x rays. He doesn't have to be standing over you for you to take x rays. Impressions, he doesn't have to be standing over you to take impressions. Okay, that you can do by yourself. Temporary crowns, that's another example. So all those can be done. The dentist has to be in the office, and he approves of you doing it, and you just do it, and then afterwards he'll see the x-rays. Once it's done, he'll see the impression, and he'll see the temporary crown once it's done. So again, he doesn't have to be working over you. Working as the operator positioning, developing mirror skills. That's another thing we're going to be working on. Establishing a working position, establishing a preferred mirror to tooth position, using a fulcrum, understanding dental anatomy, understanding cavity preparations, adapting instrumentation, applying dental materials, and evaluation of expanded function. Operator positioning and developing mirror skills. In the operator positioning, you're going to follow all guidelines and avoid curving the spine and slumping. Mirror skills, maintain posture, reduce eye strain, and complete specific functions. Position yourself to gain a straight-on visual effect, and mirror must be kept parallel to the working surface. And you always want to use what's called a fulcrum. A fulcrum is a finger rest that stabilizes the hand. So you will hold the hand, the instrument. So in this case, they're holding the instrument in a pen grasp, okay, like a pen. And then their fulcrum is their middle and ring finger. So they're stabilizing their hand on the teeth, which is okay. You could do it on the cheek, on the teeth, on the chin, wherever you feel that is comfortable to lay your hand on so you can work in the mouth. If you don't, your hand is going to get very tired, and you're going to risk straining your hands. So you must need use a fulcrum. You might hear me in the lab constantly saying, where's your fulcrum? Where's your fulcrum? So make sure you know what a fulcrum is. Understanding dental anatomy and cavity preparations. Knowledge of dental anatomy must be attained if you are to gain an understanding of a dental procedure and a delegated function. To know where to place the dental material and how to apply matrix band and wedge, it is important for the assistant to understand specific cavity terms and classifications. So we went over that a little bit, and we'll keep on going over it more on charting the classifications, the symbols, and we'll be going more into cavity terms, your surfaces. So please, I've gone over that already. We will go over it more, but you need to study that. Adapting instrumentation, you must be able to adapt the working end of the instrument to the tooth surface, and then to go one step further by correctly moving the instrument. By moving the hand, wrist, and forearm as a single unit for enhanced strength, by moving the fingers back and forth in a more confined or precise area. Applying dental materials. When you take on the function of placing a dental material into the mouth or a cavity preparation, you also need to know the application process. Each dental material is unique in how it is used and where it's placed in the mouth. And again, we'll be learning that as we learn procedures. So when we learn a procedure, you'll know the different dental materials that go along with it. First and foremost, we need to learn the instruments, which is our next chapter that we're going into. Evaluation of expanded functions. You are accountable for your skills. The same way you are accountable for your assignments. You are accountable and you are responsible. You need to make sure. I'm trying to get you ready for the real world. So if you have deadlines, you should meet those deadlines and not be late. In the office, you will be accountable for the patient that you work on. You will be responsible that before you leave the office, you have written up their chart. You should not leave the office and the chart is not written up. Every chart must be written up on a daily basis because you might see 50 patients a day, 25, 10. If you can't remember, if you're not good at remembering, you should write the patient's chart and all the things that you've done before, or right after the patient has left. If you have time, say you're working on a patient and you're waiting for them to get numb, you can start writing up your chart because you know what you're going to do. You just don't submit it yet until the end of the procedure, especially if it's on computer. You'll start typing it up, and then as the procedure goes along, you can continue typing as you get moments, because usually some procedures have some stopping points. And then, of course, at the end, when you finish with your patient, you can finish typing your notes. If it's a paper chart, you can start writing in your paper chart and then you can finish it as soon as the patient leaves, and then you hand the chart to the front desk. Usually, once you finish writing up the chart, the doctor comes in and he double checks it and he signs. So make sure that you, again, are accountable and responsible for all your skills and assignments. You must attain the knowledge and skill needed for an expanded function through mastery of course material and also by talking with the dentist with whom you practice. Any questions?